always looking sad, resting bitch face, people tell you you look angry, here's how to fix it. Okay. Hi, Dr. Janabana here, and welcome back to my YouTube channel. So we have Bev here, prepped and ready for treatment, all numbed up. One thing is that Bev doesn't actually have a very angry face, and she doesn't have RBF either. But sometimes, Bev, I've come across you while you sit at the front desk and you do look worried. Sometimes trying to squeeze patients in, and you're like, oh, where am I going to put them? And it does make you look a little bit stressed and worried. So we are going to change that for Bev, and something simple, changing emotional attributes. So the way, it's like a biofeedback. So the way your face looks, influences the way people act towards you. So if you do look worried or angry or tired, non-trustworthy, people react a certain way, and there is a simple way to modulate your emotional response without actually changing the way you look, and that is using botulinum toxin. So anti-wrinkle injections into specific muscles, and it changes the way you come across. So a lot of people, say, I'm not sad, I'm not angry, I'm not worried, I'm great, I'm happy, but people are scared to approach me because of the way I look. And that's often the depressor muscles in the face. So when you are frowning and looking angry, I can't actually frown, because I did my own a couple of weeks ago, so I can't frown. But if you look angry, I can look angry with my eyes, maybe. Or if you look sad, like, I also can't look too sad, because it's up like that. Because there's these muscles that pull your face down. You can deal with that in a simple and safe way, and I'm going to show some of the treatments to you now and demonstrate them on Bev. So if you have a look at Bev's face, which is so beautiful, Bev has a beautiful face. So Bev, if you don't mind looking cross into the camera, if you look angry, so angry, worried, so that's where those muscles go towards the muzzle. They depress the eyes and eyebrows down, and they're really big muscles, so they actually need quite a bit of botulinum toxin. And it's 5 injections, 5 to 7 generally, and it's 20 to 25 units. So a lot of people think, oh gosh, when I say 20 units or 25 units, it's 20 little injections, but each point has a specific amount of units that are injected. And a unit is the amount it was that's used to be able to have a mouse tie. That's how they calculated what the unit of botulinum toxin is. It's a bit morbid, but that's what it is. So what's happening is the corners of the mouth pull down. The chin also goes up. So when we age, sometimes you get tightening of the chin. So we'll do that for Bev as well, is relax the chin muscle, so the lower face is also relaxed. And Bev has a beautiful smile, and if you've got a beautiful smile and you deal with people, sometimes it's not always a good idea to inject around the crow's feet, because you can get like a straight smile or puffiness under the eyes. If you've already got like a hollowing under the eyes, it make it look a little bit worse, because it weakens the muscle. And also there are no lines of surprise along Bev's forehead, and that forehead is the only muscle that actually lifts the face up. But just a quick tutorial on it, Bev. So if you don't mind lifting your brows up for me. So Bev doesn't have much of a intense lift, and if you relax and then lift, so there's a slight move down of her hairline, and then most of it is concentrated like lower down. So there's a line that they call the C line on the forehead, or the frontalis muscle. And when you lift your brows, sometimes your hairline comes down. So we have to have a balance of how we inject this area, because that's the only muscle that lifts the brow. So very lightly into the skin, often when it's below the C line, so you don't create heaviness in the brow. And you can inject above that C line, onto bone almost, and that'll like raise the hairline, so you get a more sort of awake look, not shocked, just more awake. But we're not going to do Bev's forehead for her. We're just going to do the frown, so that worried looking face, and then the DAO, which is depressor anguli oris, so the depressor of the angle of the mouth. One of the things that can, Bev knows the consent for botulinum toxin as well as the post-care. We do it every day with our patients. So, but one of the things that can happen with these areas before I inject is the DAO. So there's another muscle, and they're not like separate. They're not like far away. They actually kind of do this. They like interdigitate. So you have to inject in the right spot. So this DAO is very superficial. So it's almost into the skin, intradermal, and more lateral. And then as you go to the middle or the medial area, then that's the DLI, depressor labii inferioris, the depressor of the lower lip, and then the mentalis, the chin muscle, which is on the bone. So you're like in the middle or like on the sides there, deep on bone. So one of the things that can happen is either one, especially the DAO, the toxin can like track a little bit to the DLI, and you can get a bit of a skew smile. So my smile is just naturally a little skew, but one side of the lip will go up higher than the other, and to resolve that you have to inject the other DLI, the other depressor. So in 14 years this happened to me once ever for a patient, and it was this year. So we corrected it by injecting the DLI. So I was on a very lucky streak for 14 years having that never happen, and it's actually not, I don't know how it happened, but it happened, and it was someone we'd been injecting for some time. So luckily it is something that can be corrected. So on this area here, so the frown area, so Bev, if you don't mind frowning again, so there's this muscle by the nose, it's called procerus. It goes it attaches to the bone and then to the skin. So we usually inject straight on the bone, and some people have those two lines that go across, and then there's some depressors here, depressor supercilii, but you get like something called the corrugators, and they actually right under the brow on both sides, and they're really powerful muscles. So they also attach to bone here, and then like as it goes to the back of the brow, it starts to attach to skin. So it's really important then when you inject more lateral or to the back of the brow, you inject into skin. So if it's a little bit deeper than it should be here, it can track into the eyelid, and you can get something called a lid ptosis. So your lid actually droops a little bit, and then a brow ptosis is a heaviness in the brow. That's the lowering of the brow. So that's the difference. So often with the lid ptosis, you can still move your brows, but the lid is a little bit droopy. Thankfully, all of these things resolve. Usually something like that would resolve in 6 weeks. No squeezing the area, having tight headgear, tight scarves, tight masks, anything on your face, no makeup, no sauna, blow drying your hair, going to do your hair, massages, riding a motorcycle. We actually have had that once, so that's why I'm mentioning it. So just to take it easy, rest on the day, and also advise no exercise and no alcohol on the day. So if you have any questions about the treatment that we just did, still the most popular non-surgical treatment in the world, you can pop them in the comments down below, like, share and subscribe.